name is Schoenberg. I have RSD. I was diagnosed about a year and a half ago by Dr. Hanna. I had been to many doctors before him for about 4.5 years, all over the country, different doctors trying to figure out what was wrong with me, and nobody knew. And when I came here, he knew immediately what was wrong, and he told me about this treatment plan that was available, and he told me all about ketamine, and I was ready to do it immediately because I would have done anything at that point for the pain I was in. And so it was only like 2 weeks before I was able to start on the ketamine. And the beginning was a 10-day infusion, Monday through Friday, for 2 weeks. And I just felt great after that. The best I had felt ever. And I was on some pretty heavy-duty pain medication prior to coming here, which I was able to get off of all of that. And I am continuing to get ketamine. We're at about every 4 to 5 weeks right now, and that can change depending on my condition. But it is a lifelong thing. RSD does not go away. There's no cure for it. But the IV ketamine is the best thing that has worked. When I get to about the 5th week, I start getting a lot of the pain back, not to the degree that I did before, but I can tell that it's time for ketamine. And then I come in for just 2 days, and then I feel much better for the rest of the time until it's time to have it again. The first time that I came to Florida Spine Institute and saw Dr. Hanna, he immediately knew what the problem was after hearing my story. And he immediately believed everything that I told him, and he knew right away what was wrong with me, and he offered me ketamine treatments. I didn't know anything about it at the time, so he wanted me to go home and research it, and I didn't have to research long to know that this is what I wanted to do, because I would have done anything to relieve the pain. And so we started 2 weeks later, and it's been a lifesaver, really. I don't know where I'd be right now if I didn't have Dr. Hanna or ketamine. Every time I come to the office, Dr. Hanna is so nice. He's very compassionate. If I have other pain issues, he's right on top of it, and he will not give up until I am in less pain. I can call and get in to see him right away, even that day. They'll fit me in somewhere. Everybody here is extremely nice. The ketamine nurses are very knowledgeable. Dr. Hanna is very caring. He hugs me every time I come in, and he does that with all of his patients. He's always very kind and very empathetic, I can tell, and he's very, very sweet.